Welcome to today's media briefing. Today we have Dr. John Shuk Kwon, Head of Communicable Disease Branch, CHP, and Dr. Larry Lee from the Hospital Authority. He's the Chief Manager. Dr. John, please. Good afternoon. Last night we have confirmed 1,325 cases. For those we have performed gene sequencing, 24 carries the L452R strain, that is a suspected Delta. 1,270 cases carry do not carry L452R strain, hence suspected to be Omicron. Among the 1,335 cases, 2 were imported. The remaining 323 cases are local cases, or 1,323. Excluding the figure today, we have 5,535 cases since the 31st of December. District-wise, Sham Shui Po, Kwai Ching, and Sha Tin have seen more cases, and also Tuen Mun, Wong Tai Sin. For cases in January, they were concentrated in Wong Tai Sin, and in February they were mostly from Sha Tin and Tuen Mun. We have received cases from elderly residential care home. Chung Fai residential care home for the elderly in Sham Shui Po, there is a preliminary positive case, that is a carer. We are investigating the case. The Christian YZ service center in Yunzhou Street, there is one confirmed case. Residents have to be quarantined. Vital residential care home in Onlai. There are 2 preliminary positive cases and some rapid test results came back positive. We suspect a transmission chain, and 40 people have to be quarantined. And also, the Jockey Cup Sam Hui Ting Center has seen a resident confirmed. The resident has been sent to an isolation center, and also there is one in Sham Shui Po by the Caritas Medical Center. One has been confirmed, and also Chong Yip Yun Daycare Center. There is also a carer who is tested positive, and also Yun Yun residential care home at Lo Wai Road in Tsuen Wan, one positive case under investigation. A resident from Hong To residential care home, preliminary positive under investigation. And also Pak Sang Hwa San Fu residential care home. Quite a number of cases have been confirmed. Many people have to be quarantined. We are still receiving more cases from residential care homes. We are investigating these cases. That's it for my report today. Dr. Lee, good afternoon. As at 9:00 this morning, we have reported 791 cases. 227 patients have been discharged. 15 patients have been discharged earlier on. Altogether, 14,307 patients have been discharged. And also 1,893 patients are being treated at the North Lantau Infection Control Center, the CHP's Infection Control Center, and the AWE, as well as 15 public hospitals. There are some reports about cases which have passed away and critical case. At Yan Chai Hospital, an 86-year-old male patient was transferred to the Caritas Medical Center. At the time of admission, his situation was critical, and he passed away at 0407 hours today. And also at QE, Queen Elizabeth Hospital, a 88-year-old female was transferred to the Queen Elizabeth Hospital for isolated treatment. She was tested preliminary positive yesterday, and she passed away at 2:17 p.m. We express our condolences to their family members. And some critical cases. We have 2 patients in critical condition. First, 84-year-old male, case 14814, hospitalized in Sherman Hospital. And second, 97-year-old male, case 18489 at Yanchai Hospital. The 2 patients have not received any vaccination. And we have 11 serious cases, 5 males and 6 females. Over half of them were not vaccinated. We urge members of the public who have not been jabbed to get jabbed, and those who have received 2 jabs should get a booster jab. And about clusters in public hospitals, as the medicine ward in Sha Tin Hospital, a 97-year-old male was tested preliminary positive yesterday. Investigation was carried out. All 33 patients in the ward and colleagues were tested, and we found 5 other patients confirmed, and 6 patients were quarantined. And all the colleagues have been tested negative with rapid test kits. More tests will be arranged. The hospital will investigate the routes of transmission, and also thorough disinfection will be carried out, and no new cases will be taken into the ward. At Two Moon Hospital, as the prenatal ward, there is a 44-year-old female tested preliminary positive. The HA carried out thorough testing for all the patients and colleagues, and 2 other patients, that is one 39-year-old female and 45-year-old persons, were tested positive. 8 patients were classified close contacts. One colleague, she did not have mask, face shield, and respirator on when the patient threw up, so she was listed as close contact as well. At Caritas Medical Center, in the medicine ward, there was a cluster yesterday, and today 2 more patients and 1 nurse are tested positive. We will continue to monitor the situation at the hospital. Concerning the several clusters appearing in hospitals, the HA is very concerned. Our experts are doing their best to trace these cases to cut the transmission chain. The situation is serious. We are worried about the virus going into hospitals from the community. That's why we will adopt a series of enhanced measures to protect patients and colleagues, including all HA staff, especially frontline clinical staff, would be subject to rapid tests. The details are being arranged for, and we have reminded all colleagues to pay attention to their own and their family members' health. Even if the symptoms are mild, they should stop coming back for work, and they should do tests. And they have to maintain vigilance. We recommend colleagues to wear 2 masks, 1 surgical mask plus a cloth mask, or 1 close-fitted mask. A knot should be tied, or a clip should be added like my mask to enhance protection. We have more than 6 months worth of inventory. We will monitor the usage. If necessary, we will procure more stocks for our colleagues' use.
There are 40 staff members who are preliminary positive, and most of them are from household or community contacts. From the hospital patient admission screening, 40 were detected, 50 were listed as close contacts. We are preparing all the detailed information, and we'll be releasing it later on. And I'll throw the floor open for questions. Please identify yourself before you put question. Lady over there. Phoenix TV. Now, how many preliminary positive cases are there today? Dr. Chong, you mentioned that many districts in Hong Kong are really hardest hit, how to evaluate the situation. Dr. Fong, will you give us more information about the central authorities giving support to Hong Kong in a battle against the virus, and how many people are going to be sent from the mainland to Hong Kong in support? Preliminary positive, there are 1,500 at the moment. The situation is pretty severe. Our healthcare system is really overloaded. It is really beyond capacity. We are identifying ways to see how we can isolate and quarantine the close contacts. For the other questions, I don't have any information. Next, please. The one at the back, please. Dot News. We've learned that many people are scrambling to get vaccinated, and there is a long queue, and they're queuing up in large numbers in the same location. There are many senior citizens. Aren't you worried about the possible transmission of virus? What advice do I have for the residents? Second, there are some residents who say that the private practitioners can get 200 doses every time, and 200 doses would not be anywhere near enough. Will the government be providing more vaccines to the private practitioners so that they can ramp up the vaccination for Hong Kong? Some figures, if I may. At LegCo, the Health Services Panel, we heard that there are 3,000 people who are under treatment in the community. There are many positive cases that are awaiting hospitalization. Does the HA have any specific figures? How many positive patients are still awaiting admission? For those who are not yet admitted, what advice do you have for them to minimize the risk of transmission? Right, let me have it go first. Under any circumstances, whether one is getting vaccinated or whether one is going to get tested, they should social distance from other people, keep the mask on properly, and observe hand hygiene. If you're talking about vaccination at private clinics, about the doses, I will follow up on these and let my colleagues know about it. Dr. Lee, in terms of positive cases, there are 2,000 or so patients who are in our hospitals, or the Lantau, North Lantau Hospital Infection Control Center, or the HA Infectious Disease Center, or AWE facility. Some of them are preliminary positive. You asked me how many are waiting admission. I don't think I have the precise number here with me. The one next, please. Now TV. Now, if I may ask about the trajectory, you talked about 1,300 today, maybe 1,500 tomorrow. I mean, have you already seen an exponential growth, an exponential outbreak, and there is no sign of the outbreak abating, despite all the stringent measures being stiffened up? And also, compulsory testing, have you changed the criteria? We've seen more cases, but the number of premises subject to CTN stands at 20. Have you changed the criteria? Are some of the buildings not be incorporated into the CTN scope? And also for the old folks' homes, we've seen a rising trend. Could you be more specific about the exact number of old folks' homes that are experiencing outbreaks? And will you be prioritizing these homes for the elderly in terms of quarantine? And also in situ quarantine, how far along is your consideration? Well, I'm sure you've heard that Omicron is highly infectious. If you don't have any particular control measures, one may spread to 10, if anything. I mean, we have an exponential growth. There are measures that slowing down the transmission. As to whether we can flatten the curve, and as to whether we can keep it down, we cannot simply count on contact tracing and quarantine because the base is so huge that if we simply rely on contact tracing, we may not be able to keep down the number. I think the key thing is social distancing. If we can keep away from people, if we don't go out and about much, I'm sure that will go a long way towards keeping down the number and flattening the curve. The number is reflecting the situation about a fortnight or so ago because there was incubation period and people will have to go to the doctor, they go get tested. There are many clusters that happen on the 3rd or the 5th. And the social distancing measures are only starting now. I think we have to wait to see a little bit more. As to compulsory testing in the community out there, we know that people are queuing up in large numbers and the demand is really huge. And there are so many cases in the community. We have really changed the criteria. If there are 2 units in a block, then we will subject the block to compulsory testing. Homes for the elderly, there are 30 or so homes that have been affected in the 5th wave. Now, most of the homes register a small number of cases, and some of them they may have more than 1 cases. I understand that the relevant authorities are considering how best we can deal with the homes for the elderly. English question, please. Gentleman over there, please.
RTHK. Can Dr. Chuan give us an overview of the COVID situation in Hong Kong now? You said there are about 1,500 preliminary cases so far, but with our testing capacity overstretched, does that mean that there are still many cases undetected? And also, secondly, will the government consider accepting RAT test result instead of PCR test in order to cut the long queues in the community testing center? And also a question for Dr. Lee. Should the hospital staff do the rapid test every day before they go to work? Thank you.
The number of cases in Hong Kong are still increasing. We have more than 1,500 preliminary positive cases. So that means that there's still a lot of cases in the community and also a lot of transmission in the community. It has stretched our healthcare facilities in every aspect. But I understand we are trying our best to see how we can streamline the whole process and try to isolate the cases as much as possible and quarantine the close contacts. I understand the rapid test still has its limitations, so we will still rely on the PHISP confirmed PCR test at the moment.
Okay, according to the recent critical conditions and also the possible local zonal spread, we actually actively considering to apply a rapid antigen test to all staff in hospital authority. But I think we will consider initially to start with the clinical staff first. Okay, so we are working out the details.
Okay.
Next question, please. Any more English questions? English question, please. The lady over there.
Good afternoon from the SCMP. There are 5,000 plus active cases right now, but more than half are still waiting to be hospitalized. Is the HA prioritizing admission to the elderly and unvaccinated? And is the hospital authority worried that people waiting to be admitted will die at home, which we've already seen before in the 4th wave, and now we have even more cases per day? My second question is, are authorities looking for designated hotels to serve as isolation facilities for asymptomatic patients? And has phase 2 of Penny's Bay started taking in patients? Lastly, can we get an update on the outbreak at Caritas Medical Center? How many hospital staff and patients are infected now? Thank you.
Okay, so we're talking about the strategies of how we handle a huge numbers of patients. And actually, we share the direction that we try to limit hospital to handle those needy groups, including those elderly, those small kids, and also other special considerations such as patients with the major medical background or maybe the pregnant. And for the other confirmed case, so we will consider the placements or maybe the isolation will be in the Asia World Expo CTF and also the isolation facility in Penny Bay. And this is the direction we are working now. And I'm also be apologetic about there will be a long waiting queue, especially for the stay-in patients. And for the isolation facility, we are on the way to using the second phase of the Penny Bay, and there will be 1,200 rooms ready, and there will be more coming. And actually, we are actively preparing for extending to the other phases of the Penny Bay, and also the additional hall in the Asia World Expo. And for the CMC, what is your questions again? Sorry.
How many hospital staff and patients are in
According to my data, there's 4 staff involved and 5 patients, together with the 3 mentioned yesterday. We are exploring. Okay.
下一題啊。
Next question, please. The lady over there. Good afternoon. Cable News. In the past few days, the confirmed case number stood at 900 to more than 1,000. Do you think the situation has plateaued? And do you think 1,300 is already the peak? Now, BioNTech and Sinovac vaccinations, how many doses do we have right now? Some experts suggest that in view of the high number of people waiting to be vaccinated, medical students should be enlisted to help. What do you think? Many preliminary positive patients are not being sent to quarantine promptly. So how can we have more places for quarantine? And do you think we should build temporary quarantine centers or use hotel rooms for quarantine purpose? We have more than 1,500 preliminary positive cases. Obviously, the number has not peaked yet. I don't have the number of the vaccinations we have at hand. However, we have been monitoring the stock, and it should be enough. Some confirmed patients are waiting to be hospitalized. We want to focus hospital beds for needy patients, including elderly patients. Other patients may need to wait to be sent to community treatment centers and isolation centers, and we are apologetic for that. We are striving to increase the number of quarantine facilities, including commissioning the remaining phases of Penny Bay as well as AWE. More halls will be opened. And also we are reviewing the discharge criteria. We will respect medical science. The decision will be made according to medical science when it comes to discharge. I would like to remind patients who are still at home, please pay attention to personal hygiene and infection risk. Wash your hands frequently and wear a close-fitted mask. Avoid sharing items and sharing meals with family members. We call for the members of the public's support. Next question. Good afternoon, TVB. Now the manpower situation is tight. Will the authority consider enlisting help from the private sector? And about testing. At community testing centers, whether there are ticketing machines or not, there are long queues. Would you consider extending the operation hours? Yes, the manpower situation is tight. On one hand, we have a lot of patients, and also we have to deploy a vast number of colleagues to quarantine centers and isolation centers. However, we already received a lot of help from the private sector. Many volunteer volunteers from the private sector are helping at our facilities, more than a score of them. And also we are asking private doctors for help. And very encouragingly, after we have extended the call for help, a lot of nurses and doctors in the private sector have written to us for inquiry. So they are surely helping a lot. Colleagues from the FHB is looking at the situation of quarantine centers. They will increase the number of such facilities if necessary. Hi, I'm from Hong Kong Economic Times. If members of the public are tested positive with the antigen rapid test, what should they do? Should they make a report to the hospital or the Department of Health, and what number should they call? And there are people who have waited for more than a week before hospitalization, and sometimes they have already become negative. Should they still be admitted to hospital, and what would you advise them to do? And about the Caritas Medical Center, you said there is a cluster from the hospital. What about the elderly patients at Ward 12A, and also further nurses and patients, assistants are infected? Well, is it still wise to exempt nurses from going to quarantine? And also today we have more than 40 staff members from HA confirmed. Who are they, and will the service be affected? If the antigen body test comes back positive, then we need a confirmative test. And we advise family members and friends or couriers to deliver the confirmative test for them. We understand the situation is not satisfactory. For the CMC, besides the 5 patients we mentioned yesterday, no more patients are confirmed. Today, 2 more nurses and 1 patient assistant were tested positive. Professor Yuen Kwok Yung has paid a visit to the hospital. He made some recommendations, and we would follow his advice. Yes, you said 40 medical staff members are infected. They are doctors, nurses, and supporting staff. Last question, please. Good afternoon. I'm from Ming Pao Daily. About the 2 deceased patients, what kind of strain were they infected with? Have they been vaccinated, and what kind of vaccines? And Penny's Bay and first and second tiers beds in hospitals, and also AWE, what are the utilization rates? And yesterday, there were 600 units at Penny's Bay, and only half of them were filled. And a lot of positive patients are waiting at home. Where is the bottleneck? Is it because of lack of manpower with the HA, or do we not have enough ambulances? And also it was reported that ambulances have to wait for 3 to 4 hours after arriving at North Lantau. Why is that? And also yesterday, on the discharge list, there is a case number 17414. Now, dating back from the new cases, it seems that the patient was tested positive last Wednesday. So did he only stay at hospital for 1 day and then discharged? Do we have cases which have turned negative before being admitted to hospital? Last question, we have clusters from several elderly care homes. So how many care homes have their residents quarantined at the AWE?
老人院
Right. Homes for the elderly, people sent to the AWE for quarantine. HA is aware of the details. 86-year-old male and 88-year-old female. These are the 2 patients. For these 2 patients, we don't know about the variants. Now, for the first patient, this patient has been vaccinated with Sinovac. You refer to the Penny's Bay. At the present moment, at the AWE Community Treatment Facility, we have 600 patients. At the North Lantau Hospital Infection Control Center, we have something like 600 patients. We are hitting capacity more or less. At Penny's Bay, there are 300 or so patients. Our colleagues are working really hard to shift the patients over to the Penny's Bay. Other than the HA, it is difficult for everybody all around, including the conveyance of the patients, the registration, and so on. So we will be working extra doubly hard to make sure that the patients will be sent to the wards in Penny's Bay. You mentioned the ambulance delivery. We've had a couple of meetings with the ambulance side, and we have sorted out many things. You mentioned 17414. I don't have any information here with me. Speaker not speaking through. The second patient, the QEH patient, whether vaccination has been done, I don't have the data. For the first tier and second tier beds, the utilization rate is well over 80%, 85%. Again, speaker not speaking through. Now we urge them to stay at home, and we hope that there are family members or relatives who can help them with the saliva test, and the patients should stay at home awaiting admission. And they do need to have our professional advice. Speaker not coming through. No, not really. The quantity is really huge. This is in operation for the 4th day, and things have become smoother a lot. Speaker not coming through. Speaker not coming through. Right. There was a question about how many residential homes for the elderly that have to be evacuated, and the senior citizens have to be sent for quarantine. There are 13 RCHEs for which residents have been sent for quarantine, and the number is changing because of the emerging numbers. For compulsory testing, the number has been reduced. The first 3 days and the 7th day, and that's for the compulsory testing. As to LiveHomeSafe app, that's to alert you to the exposure risk. Although this is not compulsory in terms of testing, if you're concerned, you should go get tested. You talked about the Yongfeng Xu Clinic. Sorry, beg your pardon. There are 40 colleagues who are preliminary positive. However, I don't have any particular information where they work. I can supplement further information. Yongfeng Xu clinic, there are some colleagues who are preliminary positive, and transmission occurred between the colleagues, and no patients were involved. That's it for today. Thank you all very much.